we've lost a lot of members, and some of our members were so discouraged they have left the profession, which is troublesome. And we have a lot of members that are still struggling themselves physically and mentally. It has been a challenge. Staffing has also been a challenge because management have used this time in order not to hire nurses. Their biggest excuse is because of COVID, because of budget cut, they have not hired people. People have left, retired. Staffing is a big challenge all around.
Right now, we're tired. We're very tired. We've been through the initial surge of the pandemic. We've adjusted our practices. We were hailed as heroes, and now we're just exhausted.
We need to be truly recognized for the work we do. We need to be truly recognized as the heroes you say we are. The hospital needs to give us adequate staffing across the board to make our lives easier as nurses so we can provide the quality care our patient needs with dignity and compassion.
Many of us nurses were suddenly at a loss. Despite coming to work to fight for our patients during the government shutdown, despite being regarded as healthcare heroes, despite the help from the community with meals and cards, CVPH management and administration decided to kick us while we were down, tired and weak from fighting the pandemic. As part of this restructure, many experienced nurses were forced into retirement.
We feel like we have forgotten. We feel like our patients have been forgotten.
As we recently discovered, the hospital instituted a hiring freeze since last summer. More than 200 jobs being held, no one being hired. Not only have we become even more short-staffed since COVID, but they're actively refusing to hire to fill the vacant positions. So ask yourselves, how do they expect us to do our job when they can't do theirs? We need help.
1 year later, guess what? I'm angry, I'm frustrated, I'm upset because before we were praised as heroes, and guess what? Now we're treated as zeros. As nurses, we continue to drown while the CEO makes millions.
We're still in the pandemic, and we still are having issues with the employers. Okay, what is your preparedness? Are you ready? Do you have enough supplies? Do you have enough staff? What's gonna happen when we have another wave? What is the plan? We yet to have a plan from the employer.
Long-time veterans and other nurses, the first thing we need is support. We also need more mental health and emotional health counselors, resources that nurses can go to when they need, because it was very devastating. This was impacted people emotionally. They still having nightmares, they still having flashbacks, so we need those resources in the facilities and in the community.
I've served proudly here for the last 23 years, loving the community, loving the people that I serve. I've worked with the hardest group of midwives you can ever meet. I'd like to keep them, I'd like to retain them. It is too difficult to retain and keep midwives when we are expected to work 30 to 50 hours of overtime each week without extra pay. It has been absurd. We have tried the hardest we can. We voted for the union of NYSNA so that we could at least keep the midwives so that we could survive.
Going back to the Albany Med nurses, I'm like so proud of them, knowing a lot of them and knowing how difficult conditions were there and continue to be there. This is their first contract. They've laid the groundwork. They need to build on that foundation, and each year their contract should get better and better and better.
It's such a wonderful feeling to know that you have a collection of nurses kind of working side by side, and that it's not just about us, what's happening at our local hospital, but that when you're part of a union, it's what's happening statewide. And if I'm on strike or I'm in contract negotiations, I know that there's all these nurses throughout the state that are watching and supporting us and rallying for us, that we're never doing anything alone, that we're always doing it together. And I think that's such an incredible feeling.
We're a dynamic union, and we have power in numbers, and we have power in the strength of our union.
It's a membership, and we want your active participation. That's when most of our rights can be preserved and most of the rights can be achieved.
This is our union. It's our union. United we stand, divided we fall.